Community Care of North Carolina was established through an early program in 1938 that was called Health Plan. This model was tested to provide medical home for Medicaid enrollees, reduce emergency room use, and reduce cost. It morphed in the 1980s to what we know now as the Community Care of North Carolina, and over the years between 1989 to where we arrived in 1990s, the design of a next generation model, which combined medical home principles, care managed support, data systems, and network structure. Ultimately, though, in 2001, the programs known as Access 2 and 3 were reorganized and it expanded statewide under the new banner of Community Care of North Carolina. The evolution of Community Care of North Carolina evolved gradually and not as a fixed blueprint. It was adapting to changing Medicaid policies, health system trends, and state requirements. The mission has remained fairly stable even as tactics have shifted, and Community Care of North Carolina has increasingly become a central coordinating and infrastructure organization, especially as Medicaid strategically has shifted statewide. The industry of Community Care of North Carolina operates in the healthcare, managed care, population health, Medicaid care management, and primary care support sector. It is not a direct clinical provider per se in all cases, although it does have embedded care management based on the receiver, but it functions as a system integrator, support organization, and health operations. It, as I said before, is closely tied to the medical home, patient-centered medical home philosophy, as well as population health and a care coordinated system. The market position for Community Care of North Carolina is widely regarded as one of the more mature and well-known statewide medical home and Medicaid care management models in the U.S. While it is specific to North Carolina, its direct competition is more local, as in like other care management organizations, care coordination vendors, or health plans that might offer in-house care coordination. But in the broader systems, CCNC competes with national care management platforms, care organizations, technology vendors that offer population health tools. In the context of the North Carolina's Medicaid transformation, CCNC is adapting to collaborate or compete with these new prepaid payer plans that now have more direct control over Medicaid, especially with the Medicaid expansion that we had earlier in 2023. Whether Community Care of North Carolina is a market leader or a challenger greatly depends on your lens. In North Carolina's Medicaid care coordination, medical home space, it is a leader. In the national managed care and health tech systems, it is one of the many models that does not necessarily dominate beyond its state, again, because this is a program that was curated for the state of North Carolina. A critique is that the Community Care of North Carolina lacks strong external competition, which reduces incentives for innovation or accountability because, again, Community Care of North Carolina is a hub for all extensions of other coordinations of care. So they're a monopoly, and therefore it's really hard to say that someone can one-up them when everyone has to go through their hub to get services. Some of CCNC's competitive advantages is the fact that they are 25 plus years in this space. So they have deep institutional experience and track records. They have a broad statewide network covering all 100 North Carolina counties with clinical and data infrastructures. They have the ability to blend like a clinical, operational, analytical, and social resources. CCNC offers a diverse portfolio of services and supports, rather than being narrowly specialized. Some of the key offerings include care management and care coordination, clinical programs and population health, practice support and infrastructure services, contracting and Medicaid integration, public health, and community partnerships. Some of community care North Carolina's challenges as Medicaid becomes more managed, they face margin pressure and role displacement if PHPs internalize care management as they have again begun a lot of since the Medicaid expansion in 2023. There also is a lack of strong external competition or oversight. There also is internal critique from staff and management structures about the communication, job stability, and the variation in policies. The ability to sustain innovation while meeting the demands for compliance, contract, and administrative burdens when you have payers such as Medicaid. These are some of the employee perspectives I was able to find on Indeed and Glassdoor. On Indeed, CCNC has an average rating of about a 3.7 out of 5 across categories like the work-life balance, their pay, benefits, and management. Someone else on Indeed said it's the best organization to work for. They have decent pay, the ability to work remote, and many good benefits. However, there are some cons that were mentioned. There was frustration with senior management, specifically people who work in non-healthcare technical domain areas, changes in leadership, limited advancement in roles, and salaries not always matched with keeping pace with the expectations of workload. In terms of community perspectives, it was really difficult for me to find a lot. However, I did find some things in academic and medical literature. CCNC is often cited as a success story. It is said to have improved quality of care, reduced hospitalizations and emergency department use, and generated cost savings. A 2008 analysis estimated CCNC saved North Carolinians over $160 million. So that is some positives on regards to the community care of North Carolina. Community care of North Carolina's in regards to community engagement. While they are not publicly documented, giving back programs, charity drives, volunteer programs are less prominent in external sources. It's important to remember that CNC's core structure is inherently aligned with social impact, improving access, integration, and supporting underserved populations through Medicaid systems. They are a mission-driven focus. Their mission is to improve the health and quality of life of all North Carolinians by building and supporting better community-based healthcare delivery systems.